Hello everyone. Today we are going to talk about chronic kidney disease and its effects on your heart. So let's say you are a cardiac patient in the form of you might have undergone angioplasty, or you might have undergone some form of cardiac procedures, or you might be absolutely normal having hypertension or diabetes, and some fine morning you are being diagnosed with a chronic kidney disease. So we have a lot of patients like this with this deadly combination of chronic kidney disease or CKD and cardiovascular disease or CVD. This deadly duo will actually bring down all your cardiovascular as well as renal systems at one point of time. And what are the complications we suspect or we expect in this group of individuals? See, CKD patients who are on hemodialysis, they are very prone to developing coronary artery disease, that is blockage in your arteries. They are prone to develop arrhythmias in the form of tachyarrhythmias or bradyarrhythmias because of hypo or hyperkalemia or other metabolic disturbances inside your body. They are very prone to developing irregular heart rate or what is known as atrial fibrillation. They are very prone to developing recurrent cardiac events because their arteries are not normal. They are very prone to developing resistant hypertension, which is a very common problem in our day-to-day cardiac practice. So how do you prevent all these problems? So CKD, if it is diagnosed early, you have to be always on the follow-up of a nephrologist as well as a cardiologist to control your blood pressure, to check your heart rhythm, to check whether you are developing any coronary artery disease. And if you are on hemodialysis, all the more you should be very cautious regarding your diet, regarding your medications to prevent accelerated progression of your cardiovascular disease in case you have one. But the silver lining to the cloud is in case you develop any heart attack, which is very common in CKD, the treatment always remains for those sort of patients. You might need a dialysis after that, but having said that, CKD patients can well be managed with all the cardiovascular interventions today. So the take home point from this discussion is if you have CKD, you should always be under the regular follow up of a nephrologist as well as your cardiologist, and you should always control your blood pressure, blood sugar, and your lipid profile to prevent any cardiovascular incident, which is very common in this subset of patients. Thank you.